Today we'll be talking about high atmospheric pressure, deep sea physiology, dysbarism, Cason's disease, nitrogen narcosis. We'll see what is it in detail one by one. What do you mean by high atmospheric pressure? So whenever you are going to at high altitude, the problem is with low atmospheric pressure. We can you interchange this word with barometric pressure. But when somebody is going under the deep sea or who are deep sea miners, the problem is with high barometric pressure or high atmospheric pressure, which is our topic. So whenever an individual is faced to high atmospheric pressure, it creates two major problems in that individual. First is compression effect on the body and the internal organ, and second is decrease in volume of gases. So there is increase in the pressure and decrease in volume of the gases. This is in accordance to Boyle's law. Now, what are the situation under which high atmospheric pressure is met? First is deep sea diving, or the men who dig underwater tunnels, they are called as caisson workers. Even they are exposed to a situation of high atmospheric pressure, and the individuals who work in a chamber called as caisson's chamber, in which atmospheric pressure is high to prevent entry of water and going under the sea in submarine. So these are the conditions where individual is exposed to high atmospheric pressure. So according to Boyle's law, pressure is inversely related to volume. So at sea level, pressure is 1 atmosphere, so volume is 1 liter. But when you are at 10 feet under the sea, the pressure is double, 2 atmosphere, and the volume is half. So this keeps on happening. This is in accordance with Boyle's law, where P is inversely related to V. So pressure is doubled and volume is halved as person is descending deeper. Now these are the barometric pressure and it affects at different depth. At sea level and up to 66 feet, the subject doesn't have any effect. At 100 feet under the sea, which comes to around 4 atmospheric pressure, symptoms of nitrogen narcosis appear. We'll see it in a bit. At 133 feet, 5 atmospheric pressure, there is lack of concentration. The individual becomes jovial and careless. At 166 feet, that is 6 atmospheric pressure, the individuals start feeling drowsy. At 200 feet, the subject feels fatigued, weak, and careless. At 233 feet, loses power of judgment. At 266 feet, the subject becomes unconscious. So what are the physiological problems associated with life under high pressure? There are two problems. First, when the individual is going down, that is at the depth, there is compression effect because of high atmospheric pressure. And when the individual is going up or coming back to the sea level, which we call it as SN, it occurs due to decompression phenomena. So there are two problems. At depth and at SN. At depth, our body or vital organs, internal organ get compressed, so we call it as compression effect. And when somebody is coming back, we call it as decompression phenomena. So physiological problems under depth are because of the compression effect. There is caving in of the chest. There is damage to the face, squeezing of air in the middle ear, squeezing of air in the paranasal sinuses. So what are the physiological problems due to effect of high pressure on respiratory gases? Now first there is effects of increased partial pressure of oxygen. We call it as oxygen toxicity. So if an individual is exposed to 4 atmospheric pressure of oxygen, we call it as acute oxygen toxicity. And what are the symptoms? Nervous system complications like disorientation, dizziness, convulsions, and even coma. But why this is happening? Because at high tissue, our partial pressure of oxygen or molecular oxygen is getting converted to active oxygen, that is superoxide anion, which is a free radical, which causes all the CNS complication. And whenever a person is exposed for a longer duration, let us say for 8 to 24 hours at 1 or 1.5 atmospheric pressure, then they exhibit something called as chronic oxygen toxicity. So we have two effects: acute oxygen toxicity and chronic oxygen toxicity. Chronic, when they are exposed for a longer duration. Then there are effect of increase. So as person is going deeper and deeper, there is effect of increased partial pressure of nitrogen. We call it as nitrogen narcosis. Because when there is increase in partial pressure of nitrogen, the nitrogen dissolves into the body fluid and it more easily gets dissolved in the fat, because our fat has high affinity to attract nitrogen, and because our cell membrane of neurons, they have high lipid content, so more nitrogen get dissolved in the neurons of the brain. which will go and which will alter the ionic conductance through the neurons, to the cell membrane of the neurons, and finally decreasing their neuronal excitability, producing nitrogen toxicity, also known as nitrogen narcosis. And if an individual is subjected to nitrogen narcosis, they will have euphoric symptoms like person is jovial and carefree. There is impairment of mental function and intelligence. The subject becomes drowsy and there is poor muscle coordination. Now, what are the problems which an individual faces while ascending back to the sea level? Decompression sickness and air embolism. So what is decompression sickness? It is also called as Casson's disease. It is also called as dysbarism, also called as compressed air sickness, Bell's and diver's palsy. Hmm. When an individual is ascending rapidly to the sea level after sufficient exposure to high atmospheric pressure deep in the sea, the nitrogen gets decompressed and it starts escaping from the tissue at a faster rate. And because it being a gas, it forms bubble while it is escaping rapidly from the tissue. And this gas bubble, it can go and block blood vessels, producing tissue ischemia and sometimes a tissue death. The symptoms which is produced by escaping of the nitrogen gas bubble is called as decompression sickness. What are the symptoms of decompression sickness? Pain in the joints and muscles of the legs or arms. Suppose it happens to go and block our joint, the gas happens to go and the nitrogen bubbles happens to go and block our joint and muscles, the patient will have pain in the joints and muscle. So patient will have problem in bending. So the another name of decompression sickness is bends. They'll have sensation of numbness because of tissue ischemia, and if that bubbles go and block pulmonary circulation, the patient will have serious shortness of breath, severe pulmonary edema, and occasionally death. So it is also called as chokes. If that causes paralysis of the muscle temporarily because of escape of nitrogen bubbles from the myelin sheath of the motor nerves, we call it as diver's palsy. If it happens to block coronary capillaries, coronary ischemia or myocardial infarction. And CNS symptoms are like dizziness, paralysis of muscle or collapse and unconsciousness due to blockage of the blood vessels of a brain and spinal cord. So what is the treatment of decompression sickness? So we keep the individual or a subject in a decompression tank. The second complication which an individual faces while ascending up rapidly is air embolism, and the symptoms are chest pain, tachypnea, systemic hypotension and hypoxemia. Severe cases, air emboli can go and block systemic circulation and blood flow to the vital organs. So how do you prevent this condition? The prevention of physiological problems occurring at depth and on ascent. First is we use a breathing apparatus which we call it as SCUBA. SCUBA stands for self-contained underwater breathing apparatus. It's a self-contained underwater breathing apparatus but an individual can carry with himself. Now it contains, what is the composition of SCUBA? It contains helium and oxygen at low concentration. And the third preventive measure is slow ascent or use of decompression tank. So use of breathing apparatus like scuba. So it is a compact arrangement for breathing which the diver can carry with him under the water. In this scuba apparatus, the air is compressed so that more air is carried in less volume. The gas amounts to a substantial quantity even when the ambient pressure is high. SCUBA stands for self-contained underwater breathing apparatus. So it's a breathing apparatus which an individual should carry when they are going for diving and they are ascending back. So this is an image of a subject using the scuba apparatus for underwater diving. So we can see it is a self-contained underwater breathing apparatus which an individual can carry with them. It contains of helium and oxygen at low concentration. So here we are not going to use nitrogen. We are going to replace the nitrogen with the helium. So what is the composition? Low oxygen concentration, because oxygen we are using at low concentration to prevent the occurrence of oxygen toxicity. So why are we replacing nitrogen with helium? We are replacing because helium has got certain advantages. First thing, helium being a smaller molecule, it has lower density than nitrogen, so it is easier to breathe. It diffuses faster and it is easier to eliminate its bubble from the body. Even helium is going to form bubbles, but whatever bubbles is formed from helium, it is very easy to eliminate its bubbles. and the amount of helium which is trapped in the body under high atmospheric pressure is much less than that of the nitrogen, because its solubility in the body fluid is less than half that of the nitrogen. And helium being less toxic than nitrogen, its narcotic effect is only 1/5 that of the nitrogen. So helium, it has got three advantages. First, it is a smaller molecule. It has got lesser density compared to nitrogen. It is easier to breathe and it diffuses faster, and its bubbles are easy to get eliminated from the body. And second, its solubility is less, unlike nitrogen, which was having more solubility in the fats of the neurons. And here it is less toxic than nitrogen, and its narcotic effect is only just 1/3 that of the nitrogen. Because of these three favorable properties, we are preferring helium over nitrogen. And the third preventive measure was slow ascent or use of decompression tank. Slow ascent, what is the principle of slow ascent? That you should ask the diver, deep sea diver, to ascend very slowly with short stay at regular intervals. Slow and stepwise ascent, only a small amount of bubbles are formed at a time, and that bubbles will also be eliminated before further ascent. And decompression time is based on this principle of slow ascent only. So after a rapid ascent, the individual is put into a pressurized tank whose pressure is lowered gradually up to a normal atmospheric pressure. Now, no decompression is required after a 30-minute dive for less than 30 minutes, and decompression for a period of hours is required for a 60-minute dive. So these are the things which you have to remember when you are asking the individual to uh, use a decompression tank. So these are the three things. First is use of a scuba, and what was the composition of scuba, why helium is preferred over nitrogen. And third is we will tell the subject to come very slowly with short stay at regular interval, so that this is going to form only a small amount of bubbles at a time, even though those bubbles will be eliminated before further ascent. And the next is and this decompression tank principle is also based on slow ascent. So this is an image of a person sitting inside a decompression tank. So this is a decompression tank which works on the principle of slow ascent with short stay at regular intervals. So how do we prevent physiological problems occurring at depth and on ascent? First is using a breathing apparatus, that is self-contained underwater breathing apparatus, which is a compact arrangement with the diver can carry with them under the sea. And second is use of a breathing mixture which contains helium and low oxygen concentration. Oxygen concentration is kept low to avoid oxygen toxicity, and helium is preferred because of the three advantages. First, it is less toxic. Second, its bubbles are going to escape at a faster rate compared to nitrogen. And the third is it has less solubility in our membranes compared to, unlike nitrogen, which was highly soluble. And the third image is slow ascent with short stay at regular intervals or use of a decompression tank. So these three are the preventive measures which a subject or an individual has to take for preventing physiological problems occurring on depth and on ascent. So now we have divided our topic into two sections. First, physiological problems which are occurring on descent, and physiological problems which are coming on ascent. So when a person is going under the sea, the pressure increases. Because of this increased pressure, all the vital organs and the internal organs, they are going to be compressed. So we'll have compression effect like squeezing of the face, caving in of the chest, squeezing of the paranasal sinuses, and they'll have symptoms same as that of alcohol intoxication. We call it as nitrogen narcosis. And when an individual is trying to come up or ascend up, the individual will have to face two situations. First is decompression sickness, which is because nitrogen, when it is trying to escape, it has got a high affinity towards neurons. So it is going to get dissolved in the cell membrane of the neurons, and it is going to have all CNS complication. So in order to avoid this decompression sickness, when an individual is ascending up, we should tell the individual to ascent very slowly, with short stay at regular interval in order to avoid this complication. So you learn the topic as problems which are happening during descent, that is compression effect, and problems which are happening during rapid ascent or fast ascent is decompression sickness. Thank you.